So we're looking at more details of the spinal cord. So this golden structure, and then continuing into these nerves, that represents the spinal cord. Bone, the lamina has been removed to show you the cord. So this is all solid cord, and it would continue down through here. And then somewhere right about here, remember, 5, 4, 3, 2, 1, somewhere right here, you'll see a little cone shape when you look close at the model. That's the end of the cord. That's the conus medullaris. That's where the spinal cord ends. Okay? Continuing off of the conus are individual, you can see, individual spinal nerves that exit as they move down into the lumbar and sacral area. These individual spinal nerves are called the cauda equina. Cauda equina, horse's tail, cauda equina. Okay, so spinal cord, conus, and cauda. Now, working our way up, you see that here they put some coverings over the spinal cord. What we'll see on other models is that the spinal cord has 3 layers of connective tissue that cover it. It's called the meninges. On this model, we can maybe make out 2 layers. The outermost in dark blue, that's the dura mater, outermost. Then you can see a little bit of pink under that. We're going to call that the pia mater. That's the innermost layer. That's the layer that's attached to the cord. But there's a very thin layer between the pia and the dura. It's called the arachnoid mater. We can't really see it here. We'll see it on a different model. What else do we have here? You can see in this bright pink color, those would represent the spinal nerves coming off of the spinal cord. Then you can see the pink ends, and then there's another lighter colored structure coming off of that. It's a continuation of the spinal nerve. This becomes the peripheral nerve. And each peripheral nerve of the body has its own name. In this case, being that these are here in the thoracic area between the ribs, they're called the intercostal nerves. So the spinal nerve is very short. It projects through the intervertebral foramen, and once it exits, it branches and becomes new peripheral nerves that go to the different neighborhoods of the body. Okay? The other structure that's on here, we'll talk about it in more detail in a moment, but is this lighter yellow colored structure. Okay, so here's the spinal cord. This is outside the spinal cord. It runs from the upper thoracic all the way down to the upper lumbar, and that's it. So what you see here is pretty much the complete structure. There's one here on the right side, and there's one hidden in here on the left, on either side of the cord. This is known as the sympathetic ganglia, or chain of sympathetic ganglia, meaning ganglia, all linked together in a long chain. That's what it's called. We haven't really discussed its purpose. We will in a moment, but this is kind of a central hub for sympathetic motor signals leaving the cord, going to the hub, and then going to the different organs of the body. That's what this sympathetic chain ganglia is for.